You have cardiometabolic syndrome. What is that? I'm about to explain. If you're a man, I can state it with that degree of assurance. You have it, because 97% of men in our country who are adults have it. So if you're of the 3%, my apologies, you do not have it. But 97%, this is a startling and outrageous level. And this is not just a United States issue, this is a global issue. So what is cardiometabolic syndrome? It is a group of problems that the body can have. One is abdominal fat or abdominal obesity. This is between your shoulder blade and your hip, and that's where you carry most of your weight, which I think at this point most people know is unhealthy. But if you haven't heard that, that's where your major organs are. So if you're holding fat around your organs, it's very unhealthy. You have what's called dyslipidemia. That's DYS. It just means that your lipid balance in your body is incorrect. This is manifested with high cholesterol, high triglycerides, maybe a fatty liver. You're also insulin resistant, meaning when you're eating a refined carbohydrate, something sweet that goes into your system right away, and your body is supposed to, when the blood sugar spikes, insulin takes that blood sugar out of your bloodstream and utilizes it as fuel. But if you're resistant to that, it's because you've had a lot of excess simple carbs and sugar. You typically have this whole complex we're talking about, and basically either you have prediabetes or you have frank already diagnosed type 2 diabetes. So that's in this. So we have the central adiposity or the obesity. We have the fact that your blood sugars are off, you're pre-diabetic or you have diabetes, you already have high cholesterol, high triglycerides, maybe a fatty liver, you have high blood pressure, that's the fourth one, and that's it. Those are the four. So that is the complex that is this syndrome. And again, worth mentioning, 97% of adult males in this country have it. And it's killing us. That's why our health is so poor. That is why our health is so poor. Now, what's the good news? They're all correctable. And by the same methodology. And it's not like, oh, for number one, you have to do this. For number two, you have to do something totally different, and those oppose each other. No, doing the right things for your health and your body. Granted, here at Root Cause, we love to tailor our programs and customize our programs, but there are some basics that I talk about all the time that address this whole syndrome and can absolutely turn your health around so you're not shortening your life, feeling miserable, starting to get brain fog, Alzheimer's early, all these terrible diseases, cancer, that we can avoid by turning around this syndrome. So if you're ready to improve your health and you want some help, we're here for you. I hope you found this video helpful. If you want more on this topic and others, click here.